Good morning and welcome to the City of Toronto COVID-19 media briefing on July 21st. First up, we have Mayor Tory. Go ahead, Mayor.
Well, good morning and thank you, Lavin. I'm proud to say that we now have more than 4.15 million vaccine doses that have been administered in the City of Toronto. We just announced that over 65% of adults are fully vaccinated, meaning 2 doses, and very soon more than 80% of adults will have had at least their first shot. Thanks to Team Toronto, who've been on the ground every single day working hard to get shots in arms, we are making amazing progress in our efforts to get people vaccinated as soon as possible. But as I've said in the past, these are moments worthy to mark, but there is much more work to be done. We will not stop until every single resident in Toronto who wants their vaccine gets their vaccine, and we continue to work hard with those who are hesitant or who have access issues so as to make it comfortable and more accessible for them to get vaccinated. I encourage people to book their dose if they haven't yet. I encourage those who are fully vaccinated to seek out friends and relatives and co-workers and others who aren't vaccinated and help them to get vaccinated. We continue to have available appointments at city-run clinics, so if you need to book your first or second dose, you can do that right away. And it's very important to note for those who may have booked their first or second appointments for later on in the summer or the fall, please consider moving your appointment up to an earlier date because you can. There are now appointments available thanks to increased supply, and you can do so with relative ease. And of course, for those who do not or cannot or do not wish to book an appointment in advance, you can, as of now, walk into any of the following 4 sites on a walk-in basis: the Metro Toronto Convention Centre, the Cloverdale Mall, the Toronto Congress Centre, and the Hangar, and you can get your vaccine on a walk-in basis within a very short period of time. These walk-in appointments will continue to be available between 12 noon and 7 p.m. Starting tomorrow, all 9 city-run immunization clinics, including the 4 I mentioned, will be offering these walk-in opportunities. The ones that will be added are the Scarborough Town Centre, the Mitchell Field, the Malvern Community Recreation Centre, the Carmen Stefano Community Centre, and the North Toronto Memorial Community Centre. They will all be open for walk-in vaccinations effective tomorrow. This is great news, and it will help more people to get vaccinated. The hours will be the same, from noon until 7 p.m. And so I encourage those who want to take advantage of these walk-in opportunities to come as early as they can and to consider booking their vaccines if they wish to do so as soon as possible. I'm very happy to report today on the success of the Team Toronto homestretch vaccination push. This push focused on the York, Etobicoke, Rexdale area of the city so as to remove barriers to vaccination and to help with access for local residents and increase vaccine uptake generally. Pop-up clinics were set up in convenient locations across 6 priority neighbourhoods, experiencing some of the lowest rates of vaccine uptake, certainly well lower than the city overall average. As previously mentioned, I had the opportunity to visit a couple of these clinics with Councillor Joe Cressy and saw firsthand the turnout and the overall positive response to these vaccine efforts from the community. In the last 2 weeks, 41 clinics were held and close to 12,000 people were vaccinated, with a 35% increase from just the week prior. 17% of all doses administered were first doses, and that is much higher than the citywide average of first doses, which is much lower nowadays. And we had a number of clinics that had over 30% first doses. So those are people we really had to reach because they hadn't been vaccinated yet at all. It shows the difference that we can make when we all work together and focus on people who have not yet been vaccinated and give them an easier and more accessible opportunity to get their shot. These are great results, and it was clear that this targeted approach works. I want to thank everyone involved for making this push, this initial push, such a success. But the low vaccine uptake isn't just limited to York, Rexdale, and Etobicoke neighbourhoods. This is something we knew we wanted to do and had to do in other parts of the city. And so we are moving ahead to our next targeted area with a focus on North York, where vaccination rates have also been relatively lower than the city average. As I mentioned, we have, on a citywide basis, almost 80% of residents with their first dose and over 65% who've received both doses on a citywide basis. This compares favorably to any big city in Canada and, in fact, to many cities across the globe. It's good, but we're not done yet. We simply have to keep working to bring those numbers up. And that is why we've launched Vax the North, and that is something that's going to increase vaccine uptake in the North York area, particularly within the 18 to 45 age group, which currently is experiencing the biggest lag in this area. This special all-weekend vaccination clinic will take place at Mcallister Square on Saturday and Sunday. The campaign will focus on the following North York postal codes: M2J, M2N, M2M, M2R, and M3A, but all Toronto residents 12 years old and up are welcome. In these targeted areas, the vaccination rates for 12-plus first dose is 60 to 64% and second dose 48 to 53%. Again, compare that to close to 80% for first dose across the city and 65% for second dose, and you can see why we have targeted these areas, because the vaccination rates for first and second dose lag considerably behind the rest of the city. With the aim of vaccinating thousands of local residents, walk-ins for both first and second doses will be welcome at the Vax the North Clinic at Mcallister Square. This two-day pop-up clinic will run daily from 8:30 a.m. to 10:30 p.m. and will feature live on-site music and entertainment, free food and beverages, as well as a number of promotional giveaways for first-dose vaccines, including TFC jerseys courtesy of Maple Leaf Sports and Entertainment. Additionally, our beloved Maple Leaf Sports and Entertainment mascots, Raptor and Carlton the Bear, will be stopping by Mcallister Square to say hello on Saturday morning. To spread the word and get as many local residents out as possible to this event, extensive outreach by the city's vaccine engagement team, community ambassadors, and numerous Team Toronto community members and agency partners is taking place this week in conjunction with the city's ongoing VaxTO campaign. Our campaign has been providing support through more than 50,000 geographically targeted telephone voice broadcasts in languages including English, Korean, Farsi, and Mandarin, as well as digital advertising, all in hopes of ensuring that the information people need to get to know when and where these clinics are will be available to those who need it. The location is convenient for many. It's on the subway line, and it's in a high-traffic area. I encourage all residents who have yet to get their first or second vaccine dose to come out and do so this weekend at Vax the North at Mcallister Square on Saturday and Sunday. We saw the results with the home stretch push in the Etobicoke, York, Rexdale area of the city, and we're hopeful that the same can happen with vaccine uptake in North York. I want to thank all of our partners who've made the Vax the North campaign at Mcallister Square possible, including Toronto Public Health, North York General Hospital, Team Toronto Hospital Partners, the Women's College Hospital, the North York Toronto Health Partners, Maple Leaf Sports and Entertainment, and a wide variety of local community organizations. This weekend-long micro-targeted vaccine push will help us increase vaccine uptake in a part of the city with lower vaccination rates, and I'm confident that initiatives like this will help us to get further ahead in our efforts to get more people vaccinated. We have heard over and over again from our public health experts that continued reopening, continued return to normal, continued back-to-school and back-to-work efforts all depend on even higher levels of vaccination. Even with our fantastic numbers so far in the City of Toronto, and I extend my heartfelt thanks to all the people that have made the effort to go and get vaccinated, we still have more to do. And so we'll just do it together. On that note, I'd like to ask Dr. de Villa to provide an update on our efforts to fight COVID-19.
Thank you, Mayor Tory, and good morning. As our media conference is earlier today, I'm reporting yesterday's numbers. Our dashboard will be updated with today's numbers a little bit later this afternoon. Yesterday, there were 42 new cases of COVID-19. 44 people were in hospital, 18 in the ICU. Yesterday, there were no deaths reported from COVID-19. Since our briefing a week ago, case counts have remained consistently low. Our most recent 7-day moving average is 22 new cases daily. The 7-day moving average for new hospitalizations is under 3 daily. It is enormously satisfying to be able to report figures like these to you. It reflects the willingness of the people of Toronto to be vaccinated. It reflects the protectiveness of the vaccines people are embracing and of efforts like the home stretch, which, as the Mayor just mentioned, is making it easier for people to get vaccinated and then enjoy the same sense of relief and protection that so many are already feeling. We're well on the way to seeing 2 million Torontonians fully vaccinated. There are still some gaps to close in certain age groups, but they too are moving in the right direction, and all in excess of 70% partly or fully vaccinated. Yesterday, Ontario's Chief Medical Officer of Health said he'd like to see Ontario's vaccination rate reach 90%. There's no question. The higher the vaccination rate, the safer we will all be. I think that one of the most important things we can do is talk to each other. If you're vaccinated, say so. If you're talking to someone who hasn't done it, please encourage them. Tell them about your experience. Tell them if you had side effects or if you didn't. Most importantly, tell them how it feels in the days and weeks after to live life knowing you've got the best protection possible. Over the coming weeks, you will see an expansion of the pop-up clinics and mobile vaccination approaches that experience has shown us works so well. Additionally, people can increasingly get vaccinated by their primary care providers and at local pharmacies. COVID-19 is surging again in many other places in the world and spreading unchecked in many more. But Toronto is in a unique and frankly enviable position compared to many other places. We're able to talk more about what we can do than what we can't. And there is no better way to secure these gains than by being vaccinated and by reaching a high level of vaccination in all age groups for everyone who lives in Toronto. I would encourage people who are not yet vaccinated to come forward, to take advantage of the peace of mind and real protection that vaccination adds to everyday life. I'm also sure that there are a lot of people who want to get vaccinated but can barely get everything else done in a day. Outreach like the Homestretch Initiative makes this easier, especially for people who struggle to get access to vaccination anywhere other than close to home. Someone reminded me that the Homestretch is that final stretch leading to the finish line. We have shown an enthusiasm for vaccination that other health authorities around the world must envy. Our young people, aged 18 to 24, are knocking it out of the park in their vaccination rates. That's not the story in many other places, and for us, is something to be very proud of. For us as individuals, vaccination is an easy win. For all of us in Toronto, a highly vaccinated city will be a new start. One where we are freer from limits caused by the virus, where we're protected against COVID-19, and where we can focus more on the things that really matter in life. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa. Good morning. Each and every day, we are continuing to administer thousands of doses of COVID-19 vaccine across Toronto. In fact, yesterday alone, more than 22,000 doses of vaccine were administered in Toronto across the network of city-operated clinics, Team Toronto partner clinics, pharmacies, and primary care physicians. At present, the majority of doses administered across our network of city-operated clinics are second doses. This is exciting, given that every single person who receives their second dose of vaccine is achieving the best possible protection against COVID-19 and especially the highly contagious Delta variant. Yesterday, during a clinic operations and planning meeting, Dr. de Villa explained to me that the people who are at the most significant risk of serious illness, hospitalization, or death as a result of COVID-19 and the Delta variant are those who are not fully vaccinated. The Delta COVID-19 variant is actively spreading, both in Toronto and across the world. This is why we continue to do all we can to encourage and support everyone in getting both doses of vaccine as fast as possible. I strongly encourage everyone who has not yet been fully vaccinated against COVID-19 to get fully vaccinated without delay in order to best protect yourself from this deadly virus. Our 9 city-operated mass vaccine clinics continue to operate 7 days per week across Toronto. There are thousands of doses of vaccine available each day in our clinics and across the network of Team Toronto vaccine clinics. Those who prefer to have a confirmed location, date, and time for their vaccine appointment can book their appointment either online via toronto.ca/COVID-19 or by phone at 1-833-943-3900. For those who are unable or prefer not to book a confirmed appointment in advance, we are also accepting walk-in vaccine appointments in some of our city-operated vaccine clinics. This includes walk-in appointments for youth 12 years and older. Today, walk-in appointments are available in the Metro Toronto Convention Centre, Toronto Congress Centre, the Hangar, Cloverdale Mall, and a smaller number of doses at the Malvern Recreation Centre clinic location. As Mayor Tory announced, beginning tomorrow, we are making walk-in appointments available in all 9 of our city-operated vaccine clinics. This will provide an even greater opportunity to receive your vaccine. Walk-in vaccine appointments are available between 12 noon and 7 p.m. daily for both first dose and second dose appointments. On average, we are vaccinating approximately 6,300 walk-in clients each week. There are more than 128,500 people who have scheduled their second dose appointments in city-operated clinics between August and November of this year. I strongly encourage everyone who has one of these second dose appointments to either go online or to call the provincial call center in order to reschedule your second dose appointment to as soon as you are eligible to receive your second dose. Our team is also proactively reaching out to each of these people to encourage them directly to accelerate their second dose appointment. For information on the eligibility to receive vaccine and to book or reschedule your appointment in a city-operated clinic, please visit toronto.ca/COVID-19. Thank you.
Thank you, Mayor Tory, Dr. de Villa, and Chief Pegg. We will now open up the floor to questions. As a reminder, it's one question, one follow-up, and you no longer need to unmute yourself. We will do that for you. So first up, we have Brian Passafume from the Toronto Sun. Go ahead, Brian.
Good morning, everybody. I just want to ask the mayor about the situation that happened yesterday and what's unfolding today at Lamport. I think a lot of my colleagues, both in the City Hall press gallery and beyond, will agree that they're concerned about how press freedom and the ability to report on your administration, particularly after another journalist was arrested yesterday just for doing his job. This morning, Jennifer Pagliaro at the Star reported that Star photographer who was allowed access to the encampment as part of the city's pool coverage isn't confident he'll be allowed to stay and has been told by corporate security that he shouldn't expect to be permitted to stay. I think I'll agree that the encampment evictions are garnering a lot of public attention and concern, but all of us are confused over what's turning out to be an overt effort to keep journalists from bearing witness to what's happening. Your defense of these situations has always been that you don't dictate how the police do their jobs, Mr. Mayor, but I really don't think that cuts it anymore. You were elected mayor, the buck pretty much stops at you here. There's some real serious concerns about transparency in the city that's made the mood of journalists swing from frustration to genuine concern over their safety. You yourself are a journalist. How will you commit to making these things right and ensuring journalists in Toronto can do their jobs without intimidation or arrest?
Well, first of all, I should say the actual decisions about what happens on the ground are made by operational people, and I have no involvement in those decisions, and I'm not even as up to date on what you said might or might not be happening today in that regard. I will say that yesterday, that upon having the issue of no journalists having any access to the area of the encampment, when that was brought to my attention, I asked the staff if they would reconsider if that was in fact the decision that had been taken, and I believe they did reconsider, and I believe arrangements were made today to have pool representatives, as is done in many other instances where you're wanting to limit the number of people that are in a given area so that there would be the opportunity for journalists to be there and observe what was going on firsthand. With respect to how people have been treated within the context of that arrangement that I asked them to consider, and which I gather was made, I can't comment. I would just say this. As I said yesterday, as I would say today, and as I will say tomorrow, I do believe that it is very important that we have transparency with respect to these kinds of things that are legitimate public issues and that involve public resources and an issue of importance to many people across the city. And it's not confined to this issue. It's on all issues, I believe that to be the case. And I would want to make sure that we made arrangements to, within the context as well, though, of the fact that everybody has to be kept safe. And that includes journalists, but it also includes the people experiencing homelessness, it includes the city staff, and it includes the protesters. And so the decisions as to how to accomplish that are made on the ground. I don't know if Mr. Ross wants to comment any further on this, but I will just say that they make the decisions on the ground with respect to how you keep people safe, but that I gather they have made arrangements to make sure that some journalists can be present representing all the journalists to make sure that there is a degree of transparency there that is more satisfactory than what might have been the case starting earlier yesterday.
Brad, do you have
Good
anything
morning.
else to add? Oh, perfect. Go ahead.
Yeah, good morning, Mr. Mayor. And Brian, thank you for the question. Yes, we, as the mayor indicated, we have made arrangements for pool coverage, both photographer and TV camera. The situation right now is that there are a number of people within the fenced-in area, and as soon as we're able to clear those people, then the pool arrangement that we have made will be permitted to re-enter. So I want to ensure that everybody understands that we will permit the pool arrangement to occur, but first we need to clear that fenced area, again, for safety reasons, and so that we can then identify the two pool photographers, photojournalists who are going to be permitted inside during the action that we take to engage with encampment residents and to ensure that we can then begin to clear any debris that may be left behind.
Okay, I appreciate that. My concern is that appreciate that you're letting photo in CP24 and the Toronto Star photographer. I don't know how that benefits non-Star papers like us or the Globe and Mail or the National Post, but I digress.
But the photos will be shared, Brian. That's the pool arrangement.
Okay, I'll check with the editor about that. The other issue is why was there no decision to allow writers in? Photojournalists are incredibly talented at what they do, but at the same time, it's incredibly difficult for writers to write based on photographs rather than actually bearing witness to what is happening. Will that decision be changed, or is it?
So we'll continue to review the pool arrangements, Brian, but today you'll have everybody will have access to the video, everybody will have access to the photo, to the photos that come out, and certainly have access to myself and to Toronto Police Service, as you have throughout, with respect to comment and what you may see with in the video and in the photographs and in the reporting that may well come from those photojournalists. They are journalists as well, and so you of course will have access outside the fence as always. So if you have questions coming out of the pool coverage, then we're happy to answer those.
Thank you. Next up, we have Nicholas Haddad from Radio Canada. Go ahead, Nicholas.
Hi there. Thanks for taking my questions. These questions are going to be for Mayor Tory, and I'm sure Brad, if you want to add some input, and we're happy to hear it. I'd just like some clarity with regards to what the next steps are for the residents or for the people experiencing homelessness who are currently staying at Lamport Stadium. I'd just like to know what the city imagines the next steps are for those people, and if that includes finding them shelter spaces. I'd love to get some numbers as to how many spaces are in fact available right now for them.
Well, I'll start off, and then Brad or somebody from Shelter and Housing can pick up as they wish. All the way through, the one thing that I have known as we have just monitored the general situation with respect to shelter and supportive housing and other hotel accommodation, I do get very regular reports on the number of spaces that are available. And contrary to what is suggested in some quarters, there has always been more than enough, well more than enough vacancy in different places with different kinds of housing to accommodate well more than the number of people that are in any particular encampment that we're attempting to persuade people to come indoors to proper indoor housing. And so that was the case yesterday and today, and I'm confident it will be the case tomorrow meaning simply any other day going forward, because we've always been conscious of the fact that, and I think the more important point in a way is, we have been making a continuous effort every single day to get people to come in on a voluntary basis. We have made 20,000 visits to people resident in the encampments over the last few months to talk to them day after day about coming into different forms. We've taken people on tours of the housing accommodation that's available. And so in that sense, there has always been, even when we took people on a tour when there was nothing going on vis-a-vis a particular encampment, it made no sense to have them go on a tour if there wasn't accommodation available. Because the real purpose of this entire exercise, this entire program on an evolutionary basis has been to persuade the people that are in unsafe, unhealthy, illegal encampments to come inside to a place where they can be safer, where they can get more supports from us, and where they're going to be not in the public parks any longer. And so that effort will continue going forward, and particular attention is paid on a day like today to the people in Lamport, which are about, I think, 20 in number, and somebody will correct me on those numbers, but I think a good number of those people have already accepted the opportunity to go indoors, as did a majority of the people at Alexandra Park yesterday. And that is the objective in the end, to get all of the people ideally to accept better indoor housing, better than being in an encampment that is unsafe and unhealthy.
Follow-up?
Thanks very much for that. Okay, I'd like to get some clarity now as to what the next steps are for the city. Will more parks be targeted with similar operations? You know, what would be the timeline? Is this something you want to get done before winter? I'd love to hear more about what are the next steps at the city.
I will just tell you that the operation to safely rehouse people indoors has been continuous, and that there are many, many much smaller encampments that might even be 1 or 2 tents that we have been going to make those visits to people in those encampments to persuade them to come indoors. We've had great success. I think more than 1,700 people have been convinced to come indoors and have been rehoused in indoor housing, and that effort will continue across the city. There are some encampments that get more attention because they're much bigger, but there are lots of other smaller ones where we continue every single day to make those visits, and that effort will continue. It doesn't matter as much what season it is, as that we need to find ways to persuade those people to come indoors to safe, healthier housing indoors, and to get the support that they often need in other areas of their life, including finding permanent housing, including finding a job, and including dealing with some other issues they might face in the area, for example, of mental health. And so we will continue that effort on a continuous basis, as we have done. 20,000 visits is not something that is inconsequential in the context of trying to go out day after day with the wonderful Streets to Homes teams that we have that sit and discuss the needs of these people with them when we're allowed to do so, and we have been obstructed in some instances from doing that, and we will continue to do that. And the rest of it, in terms of what happens with encampments, will be decided upon by the staff who make these operational decisions. But our efforts to deal with this in a compassionate way and to bring people to indoor housing will continue, as it has been the case for months now.
Thanks, Nicholas. Next up, we have David Ryder from the Star. Go ahead.
Hi there. Just following on, I guess, the previous questions, and this is, I think, for Mayor Tory and Brad Ross. Can you give me exactly the reason, rather than just some general safety concern, for not letting reporters and photographers, all of whom in the city carry identification, which we show at many events, including city events, in to observe what city staff and police are doing on behalf of residents? And I don't know if it's true. I saw a quote from somebody on the scene saying an officer had said, maybe somebody would go in pretending to be media and then harm an officer, which, if true, is frankly nonsense. And I think you both know that. So please tell me exactly why there are restrictions like this.
Well, I'll just start off by saying that it is not unusual at various different kinds of events where there are complications involving safety considerations and involving large numbers of people that you're trying to manage and keep everyone safe, to have pool arrangements made with respect to journalists. In fact, we've done it during the pandemic for health-related reasons, where people relied upon a certain number of reporters or photojournalists to come and cover things. And so I can't speak to the exact arrangement that was made, as you well know. Yesterday, when I was told the arrangement was somewhat different, I requested that staff consider amending those arrangements, which I gather they have done. I only want to add that anything that appears on Twitter, I automatically question its veracity, and I would not believe that that kind of a statement would have actually been made, and I don't associate myself with those kinds of comments, but I do have a concern always about when there are crowd scenes and things going on that involve complicated operations involving staff and police and the protection of people who are experiencing homelessness and journalists, that safety has to be a paramount consideration. Brad?
Yes, thank you. Good morning, Dave. Yeah, look, first of all, I don't condone that statement either. I don't know where that came from, frankly. Yesterday, to be perfectly honest with you, our objective was to expedite and get the people who were encamped at Alexandra Park into safe indoor accommodation. We know that in the past, so at Trinity Bellwoods Park, for example, that with people inside the fencing, the protests became prolonged, and in fact, we were unable to provide an offer of housing to one individual. And so when there are cameras inside the fenced area, our feeling was that it simply prolonged the event itself. And then in addition to that, there's frankly the privacy concerns of the encamped occupants themselves when our streets to homes workers are trying to have conversations, private conversations with people about their complex needs, their individual needs. And frankly, having cameras and media presence can be intimidating for people who have traumas that we don't fully appreciate and understand necessarily. And so that was the rationale. I appreciate everything that you and your colleagues have said, and the mayor's what the mayor has said, and that's why today we agreed to arrange for a pool operation for both photography, still photography, and television, so that you can see and that journalists can see firsthand, independently, the operation inside the fencing. The fencing, I want to be clear, is not barricaded. There is no barricade. There is no nobody is being prevented from obviously reporting outside the fencing. But I also understand the concerns that you have raised, which is why we have made the arrangements we did today.
Thank you. My follow-up question is for Dr. de Villa, and that's we've seen in many places, including the UK and Australia, where the jurisdictions who seem, I think, to have thought they were where we are now, where COVID is kind of on the retreat and life can get back to normal, in fact, all of a sudden surging Delta rates. I just want to make sure I understand if what you're saying earlier in your comments is that our vaccination rate is higher, that you think we're protected. And I'll shorten my long-winded question to say, do you have concerns that we will see Delta flare up, I guess, primarily among unvaccinated people here in Toronto like we're seeing elsewhere?
So David, thank you for that question. I would say this, look, when we're talking about individuals who are not adequately protected by vaccines, absolutely the risk exists for infection with Delta variant and all the consequences that go along with a COVID-19 infection. That's why you'll hear me speak about this constantly, the need to get vaccination coverage rates as high as we possibly can. As I mentioned in my remarks this morning, the higher we can get that vaccination rate, the safer we will all be, whether we're talking about here in the city of Toronto or throughout the province. No question, the protective benefits of vaccine are something that we really want to see as high as possible across our entire population. And of course, still a little extra caution, recognizing that there is Delta variant here in Ontario, here in Toronto. And so where possible, making sure that we're continuing to be vigilant around practicing public health measures and ensure that, of course, if you're sick, to stay home, to get yourself tested appropriately. It's these kinds of measures combined with vaccine that will see us to the other side of this as soon as possible.
Thank you, David. Next up, we have Mark Mcallister from City News. Go ahead, Mark. Mark?
Yes,
Okay.
sorry, I wasn't sure if I was unmuting myself or if I was being unmuted. I apologize. Getting back to the homeless encampments. Throughout all of this, and we've seen multiple clearings now, including today, there has been a call from those living in the encampments and advocacy groups saying that the city isn't going about this the proper way and that more engagement needs to take place. More interaction needs to take place with those working on behalf of the people that are living there. What can actually be done differently? I know that the city has said that you've done what you can and are doing things, but have you looked at doing things differently than is being done right now?
We are reviewing what we do and how we do it every day with respect to the ongoing desire that we have to take people who are presently in encampments and convince them to move to indoor housing. And I would say that what we have been doing, people often look at the relatively few people that are left in these encampments compared to the 1,700 plus people that we have successfully convinced over time through the excellent work of our Streets to Homes staff to go to alternate forms of indoor housing. And so we will continuously look at ways in which we can do those things better. We have been looking at and making changes to the supports that we offer when people get to the different forms of indoor housing so that we're providing supports to people who need it with regard to harm reduction, mental health, and so on. We're continuously reviewing that. We added in things like taking people on tours of the indoor housing so they could feel more comfortable accepting the offer. But I'll also say to you, we need to have some cooperation. You know, I don't think all the facts are on the table with respect to the quite deliberate obstruction that often happens and the abuse, by the way, that is handed out to our city staff who are just doing their jobs as public servants to go and try to persuade these people, these vulnerable people, to accept indoor housing, and the response that they're often getting from people who claim to be advocates on behalf of those very same people are obstructing access to those people. Telling them after the Streets to Homes people leave they should never go anywhere, and making statements, as I saw on television myself last night, that these places are full of COVID, which couldn't be further from the truth. And I think we have to have a hard look at that too. So is there a way in which we can do better? Of course, there always is. Am I willing as mayor to request, as I have done many times, that we review the efforts we're making on a continuous basis to get people to come inside and the different offerings that we have and the supports we provide? Of course I am. But in the end, there are some people who, whether of their own volition or because they've been persuaded to do so, just say they're going to remain indefinitely in public parks, and that is not safe, it is not healthy, and it's not legal. And we cannot have public parks that are, in effect, occupied to the point where, say, in the case of Alexandra Park, we couldn't even use that park for camps for children who need those camps. And neighborhoods that told us in letters they wrote to my office and to the city saying, please, we need our parks back. And we have to, at some point in time, say we've tried and we've tried and tried 20,000 visits, and now we have to take some other steps to make sure that people are moved to that indoor housing and no longer remain in the public parks.
And as a follow-up to that, you've said deliberate obstruction and abuse is what the Streets to Homes staff are facing, and others. You also mentioned that they've been kept from actually engaging with some of the people in those encampments. Can you expand on that and explain exactly what is happening?
Well, I'll say, first of all, that some of the city staff, and these are public servants who are doing their jobs, and they're very compassionate, professional people who are accustomed to working with people experiencing homelessness and understand some of the issues they're facing, and are trying to engage in the very delicate task of convincing those people to come from the encampments to different offerings of indoor housing. And they have been followed home. They have been harassed at their homes. They face all kinds of verbal abuse, the likes of which most people would never be expected to put up with in their jobs, from, frankly, the protesters. And in some cases, they have been literally obstructed from talking to the people experiencing homelessness because they have decided, the protesters have, that they know better than anything a Streets to Homes worker might say to those people. And I find that to be something that is puzzling at the very least, and I can't really say I find it acceptable, because these are just hardworking public servants trying to do their job, and they're trying to do it in a way that hopefully will really help the people experiencing homelessness by putting them in a place where they can get more supports, but also help to reestablish the principle that public parks are not places people can legally, safely, or in a healthy way live, and that everybody is entitled to the use of those parks, including neighborhoods like Alexandra Park, which were pleading with us to make sure that their kids could have opportunities to have summer programs and so on, which they couldn't do. So that's what's been going on, and it hopefully, I mean, I'll just say one more thing. Compare the experience yesterday, where what you had was the Streets to Homes workers relatively unobstructed in going to do their work at talking to the individual people experiencing homelessness and offering indoor housing for them, the majority of which offers were accepted, without any interference from protesters, to today, where you have many, many more protesters, which necessitates the presence of more police officers in order to make sure that the protesters, the journalists, the people experiencing homelessness, and the city staff, in no order, can be kept safe, because it just creates an element that can lead to less than safe conditions. And so I would just say that we're trying our very best to do this in a way that I've described many times as compassionate, but also firm in the sense that we must find safer, more healthy, legal, indoor accommodations for people who have many needs for support in their lives, provide those supports, and do it in a way that preserves everyone's safety. And that is what we're trying to do, and some people decide that they will make that task more difficult for us, as opposed to trying to exercise their right to protest, but at the same time cooperate with something that is an entirely legal extension to the efforts that we've been making to rehouse people.
Thank you, Mark. And next up, we have Annie Bergeron Oliver from CTV. Go ahead.
Hi, thank you very much for taking my question. This is for Mayor Tory as well as Dr. de Villa. Many businesses want to advertise that their staff are fully vaccinated, and some are even asking patrons to be as well. The result, though, seems to be a very strong backlash, especially online. You know, one website, The Safe to Do, advertising businesses with fully vaccinated staff even had to be pulled down because the backlash was so severe. I'm wondering, what advice do you have for these businesses?
I would only say, to start off with, because this is more of a question that's into the realm of, I'll call it politics, small p politics, as opposed to health, that this is an issue that I can just tell from all the commentary I'm hearing out there is something that is in need of some greater guidance for those businesses, and maybe in need of even businesses sitting together to discuss this, because the chances of there being very negative, divisive instances that happen, or incidents that happen inside businesses, and even to the point of disrupting what we want by way of a kind of an orderly, robust recovery for people, so people can get back to work and can go back to earning a living and living a normal life, is something that is, you know, that certainly could be placed in jeopardy. I mean, it's one of the reasons why, and I you know, why I thought that making easily available to people some proof that they've been vaccinated, and I simply meant the kind of receipt that is actually now available to people and they can go online and get, was going to be important, just because people are going to be asked this question, whether it's asked as a result of deliberate policy, or it's asked in a conversational way, or it's asked because people are trying to get back into their own country pursuant to federal government policies. So I think we have some distance to go on this. I am talking to major employers next week, principally about the whole return to work question and when that's going to happen and how that's going to happen, and about the hybrid arrangements and things like that. It's more focused on return to work as a part of recovery. But I certainly will be asking them about their own policies and their own intentions in this regard, because I think the one thing we can't afford to have is an incredibly divisive situation happening inside workplaces or even inside the city as a whole that pits people against each other or causes any kind of disruption, at the same time as we have to be mindful of people's right to privacy. And so it's a very difficult issue, and I think ultimately there will be some guidance that will be asked for from governments through public health or otherwise.
So if I can add a little bit to that which the mayor has already said, you know, we are in a novel set of circumstances, and I think that this is a challenge, not just here in Toronto, but throughout the world. We've never found ourselves in this particular circumstance, and I think we're trying to apply the best available evidence and the best available science to this particular situation. There's no question, as I mentioned earlier, that the higher the vaccination rate, the more we are able to get people to take up vaccine and to get fully vaccinated, the safer we all are. And exactly as the mayor says, you know, we don't want to see any of this, you know, increase any amount of divisiveness in any part of our society. That doesn't serve any of us well. So I think that what the mayor calls for, ongoing discussion, particularly with our provincial counterparts, in respect of what are the evidence-informed measures that can be taken, what are evidence-informed policies that perhaps can be put into place that are effective in terms of increasing both vaccination coverage and increasing confidence in vaccines and the protective benefit of vaccines. These are the kinds of actions I think we should all be implementing and rallying around. And thus far, when we look at our vaccination numbers, you know, we're moving in the right direction, and I think we should do everything we can to keep it moving that way.
Annie, do you have a
Thank you very
follow-up?
much. I do, yes. Thank you very much for those thorough answers. My follow-up will sort of be along the same lines. Mayor Tory, you mentioned that some type of guidance may be needed. I'm wondering if this is something that the city might be able to provide. Are you going to look more to the province? What type of guidance perhaps from the federal government? Because, you know, there are now two groups of people. There are those who are vaccinated, those who are not. And, you know, this is becoming a divisive issue, and perhaps maybe more divisive as rules start to be in place that maybe allow vaccinated people to do things that unvaccinated individuals cannot do.
One thing we've learned through the pandemic in a number of different instances is that when you do things locally, especially in a big city region like this and in a big province like this, it just doesn't work as well. You have such incredible mobility back and forth, even between people working in businesses that work in one office one day and another office another day in different cities and so on. And so in order to be effective and avoid confusion, you really have to have, I think, measures or advice or guidance that is rendered on at least a regional basis, if not a provincial basis, and sometimes national. I think in the end, what really has to happen here, and we've been dealing with so many things at a time, and our priority has to be and should continue to be working with everybody to get people vaccinated so that this becomes a lesser and lesser problem the more people get vaccinated. But I think it may be one of those instances, and I don't blame anybody for the fact these discussions haven't taken place in earnest, because everybody's been scrambling to get the vaccinations done and to fight the pandemic off and to look after the people who are ill and to look after the social needs of people who are vulnerable during the pandemic, such that there hasn't been a sit-down as yet between business, I would say labor as well, because you have occupational health and safety legislation that could come into play here. You could have somebody that shows up at work as an individual entirely, turns to the person next to them and says, "Are you vaccinated?" doesn't get an answer that satisfies them, and then decide that they're going to absent themselves from work as they're legally entitled to do because it's not safe. And so all of those things just form the potential for the kind of divisiveness and disruption that we really shouldn't have. And so I think it maybe is time for labor, business, and governments to sit together and see if there's a way in which some guidance can be offered industry to industry or however it's done. I just don't have a particular view on that. That's going to be more in the domain of health-related things. We've done so well relying on health-related considerations, sometimes at a great cost in the context of business and so on. But I think it has saved many, many thousands of lives in Canada and in Toronto. I think it has avoided many other people becoming victimized by COVID-19 and being hospitalized and potentially having life-altering health consequences, even if they stayed alive. And so I think now, as we enter this next phase, that the same kind of health-based approach is called for, but maybe in discussion with business and labor and government to see what makes the most sense from a health standpoint and then can be practically undertaken.
Okay, that's it for today, everybody. Thank you and have a great week.